Hello everyone. We are going to start with the topic of gross anatomy of heart, and this is the part 1 of the lectures. So we have been hearing a lot about the heart diseases. Since heart is a vital organ, so it attracts attention very soon. There are many cardiovascular diseases which may be life-threatening, may be adult or congenital, and for them various investigations are also there for which we need to know the gross anatomical appearance of the heart. Even the surgical approaches also need attention towards the structures nearby, and that is why we need to know the normal gross anatomical aspect of the heart. So with this, the learning objectives have been derived for this particular topic, that we need to identify various external features of the heart and to describe the internal structures within the heart, to describe the blood supply of the heart, and then correlate the knowledge of anatomy with the clinical aspect. So we will study the anatomy of heart under these headings, that is introduction and shape, size, site and gross features, whether external or internal, its relations, its blood supply, nerve supply and the clinical aspects. In this, heart is a vital organ and it is a muscular pump which pumps the blood to the whole of the body. It has 4 chambers, the right and the left atria, which are slightly posteriorly placed, and right and the left ventricles. The circulation goes through the right side of the heart, which carries deoxygenated blood, and from the right ventricle goes through the pulmonary arteries to the lungs, where it is oxygenated, and then it comes back to the left side of the heart for distribution to the whole of the body through the left ventricle and then through the aorta. The heart is located just behind the sternum and adjoining costal cartilages and intercostal spaces. It lies in the middle mediastinum covered with the pericardium, and it is slightly deviated towards the left side, and if we draw a mid-sternal line, only 1/3 of it is seen towards the right side, rest of it is more towards the left side of the thoracic cavity, and it extends from the third rib to the first rib, lies on the central tendon of the diaphragm. Heart is said to be of size of fist of your own hand. It is about on average 12 to 9 centimeter and weighs around 300 grams in males and 250 grams in females. It is said to be pyramidal in shape. Since it is pyramidal in shape, it has an apex and a base which is directed posteriorly. It has 4 borders: right border, left border, superior border which lies hidden under the great vessels like aorta and pulmonary trunk, and an inferior border. It has 4 surfaces, 2 pulmonary surfaces, that is on the right side and the left side, anterior sternocostal surface and diaphragmatic or the inferior surface. Heart is located in 5th intercostal space on the left side in adults, while in children below 2 years of age, it may lie in the fourth intercostal space. In adults, the apex lies about 9 centimeters from the midsternal line in left intercostal, fifth intercostal space, or it lies just medial to the midclavicular line in the same space. The base of the heart is also called as the posterior surface. It is formed by both the atria, with left atrium contributing to the maximum, while right atrium contributing only 1/3 of the base of the heart. And we can even see certain openings here, like openings of superior and the inferior vena cava, plus 4 openings of the pulmonary veins. There are 4 borders of the heart, as we can see in this picture. The superior border, which lies hidden behind the great vessels, is generally formed by 2 atria, especially mainly by the left atrium, while the inferior border, which is almost horizontal and formed by both right and the left ventricles. While right border is contributed only by the right atrium, while the left border, which is slightly curved, and it is contributed by the left ventricle mainly, but superior aspect is contributed by the left auricle also. Sternocostal surface is the anterior surface of the heart, which lies under the cover of the sternum and the costal cartilages, is mainly contributed by the right ventricle. On the right side, it is also formed by the right atrium and the right auricle, while on the left side, it is formed by the left ventricle. This surface is covered, apart from sternum, by the lungs, except in the area of cardiac notch. So when we percuss the surface over the heart, this gives percussion in the area of cardiac notch, gives a feel of dullness. So this area is called as area of cardiac dullness. The surface also has various grooves or sulci, and these sulci are one between the right atrium and right ventricle, which is also called as an atrioventricular groove. This is commonly known as coronary groove. That is because of the presence of the coronary arteries in this groove. So this is the anterior aspect of the coronary groove, which separates right atrium from the right ventricle, and this groove contains right coronary artery. There is another groove which lies between the 2 ventricles, and that is between the right and the left ventricles. This groove is called as anterior interventricular groove, and in this groove is buried the left anterior descending artery or anterior interventricular artery, which is a branch of left coronary artery. We will study that in the later lectures, along with the vein which is called as great cardiac vein. The diaphragmatic surface, which is also known as inferior surface of the heart, this surface rests on the central tendon of the diaphragm, and it is formed by the right ventricle and the left ventricle, mainly contributed by the left ventricle. And there is a small groove seen on the center, almost in the center, which is called as interventricular groove. Now this is the posterior aspect of the interventricular groove, and this is called as posterior interventricular groove, which contains posterior intercostal artery. This is seen with the red color, and middle cardiac vein. The posterior interventricular artery is most of the time is branch of the right coronary artery. There are two pulmonary surfaces, right and the left pulmonary surfaces. On the right side, this surface is formed by the right atrium, while on the left side, this surface is formed mainly by the left atrium, only in the upper part by the left auricle. These two surfaces are related to the root of the lungs. Heart can be seen as a muscular organ in this wet specimen also. It is pyramidal in shape, and we can see on the upper aspect the aorta and pulmonary trunk. Since it is pyramidal in shape, this has an apex formed by the left ventricle. So this is the apex, and on the posterior aspect is the base, which is formed by left atrium and right atrium. This is the left atrium, and here we have the openings can be seen in the left atrium with the probes in. So there are four pulmonary veins which open into it: right side superior inferior, left side superior inferior, and it is also contributed by the right atrium. Here the probe has gone through inferior vena cava, and this is the right atrium which is contributing to the base, and this is the anterior aspect, and in the anterior aspect this is the superior border, and here we have superior vena cava and right border, and this is the inferior border which extends from the right to the apex of the heart, and then the left border formed mainly by the left ventricle. This whole surface is called sternocostal surface. The sternocostal surface and the diaphragmatic surface. This is the inferior or the diaphragmatic surface. The sternocostal surface has three chambers of the heart contributing to it: right atrium, right ventricle, and left ventricle. So this is the right ventricle, and this is the left ventricle. Two are separated by interventricular groove. This is the right atrium. This is the left atrium, and the right atrium has auricle also. This is the auricle, which lies close to the infundibulum of the right ventricle. The right ventricle continues into the pulmonary trunk. The right and the left ventricles are separated by a groove, and similarly right ventricle and right atrium are also separated by a groove called anterior atrioventricular groove or coronary sulcus. It contains right coronary artery. This is right ventricle and left ventricle, which are separated by interventricular groove, anterior interventricular groove, which contains left anterior descending artery and great cardiac vein. Vein can be seen in this.
Then the diaphragmatic surface, the anterior interventricular groove continues onto the diaphragmatic surface as posterior interventricular groove, and the coronary sulcus or atrioventricular groove also continues posteriorly. This is arch of aorta and pulmonary trunk are connected by ligamentous arteriosum, which is a remnant of the embryological development of ductus arteriosus.
Since heart is an important vital organ, its nearby relations are also important. Superiorly, it is related to the aorta here and the pulmonary trunks on right side to the superior vena cava, while inferiorly it is related to the diaphragm because the heart rests on the central tendon of the diaphragm. Anteriorly it is covered by the sternum, costal cartilages, ribs and intercostal spaces. On the lateral aspect, it is related to the root of the lungs. Posteriorly, it is related to the structures which are lying in the posterior mediastinum, and all these structures are separated from the heart by the pericardium. The structures, important structures which are related to it posteriorly are the pulmonary veins which are lying within the pericardium, then aorta and esophagus. Then posterior to the esophagus and aorta there are vertebral bodies of 5th to 9th thoracic vertebrae. This is an important relation from the clinical aspect, which we will discuss later on. Heart can be examined in living by percussion, which can give us demarcation of the heart boundaries on the surface, and any shift of the apex of the heart by means of apex beat, which can be even palpated, can tell us about the status of the heart. For example, in case of enlargement of the heart, the apex beat will shift downwards, and heart can also be examined by means of auscultation by listening to the heart sounds or any other additional sounds. Visualization of heart in living can be done by simple plain X-ray of chest, and generally done by the posterior anterior view. And in this, measure the cardiothoracic ratio, and this measurement also can tell us about the size of the heart. This measurement can be done, or the ratio can be calculated by measuring the maximal horizontal diameter of the heart divided by maximal horizontal diameter of the thorax, which is measured from the inner border of the ribs on the right side to the inner border of the ribs on the left side. And this ratio should not be more than 0.5, and if it is more than 0.5, that can identify the enlargement of heart. Knowledge of posterior relations of the heart have been important, and this has been utilized for an investigation called transesophageal echocardiography. The transesophageal echocardiography is done to visualize the posterior chambers of the heart, which are atria, especially the left atrium, and this is done by putting the probe into the esophagus to visualize the left atrium. Knowledge of clinical aspect and the external features of the heart can also be utilized to know how we can approach it surgically, and the heart can be approached surgically for the surgical procedures by mid-sternal incision, or by for if we need to do some minimal invasive surgeries, then we can approach heart from left anterior thoracotomies also. Thank you.